Well, the Trading Mill team has just arrived here in Upper Hill, and we are at the NHIF building. And right behind me is the man of the moment. This is Dr. Peter Kamunyo, CEO of NHIF.
Karibu Abu.
And we'll be having a great discussion on just what the fund is all about and what does the future look like for the NHIF. Thank you, Daktari, for joining us on the Trading Bell Show. First time on the program. Welcome.
Thank you very much, Ben, and it is indeed a pleasure for me to be on the show.
All right. And we are in a pandemic period as a country, as a world, and our healthcare system has literally been exposed when you look at the number of admissions in hospitals and the overwhelming cases that we are seeing across the country. And this literally tells us that we need to go back to the drawing board. Perhaps just give us a sense of how has the NHIF performed in this pandemic period? What are some of the learnings that you have picked? And of course, the successes.
Yeah, thank you. Actually, in this case, with the pandemic, as with everyone, it was totally unexpected. It was a surprise, and everyone was literally guessing about what is going to happen next. We've seen what is happening with the global economy, even including the Kenyan economy. But for us, I would say it had very interesting insights and outcomes. At the onset, after COVID was declared a pandemic in March 2020, all systems literally crawled to a stop.
Yeah.
And we're looking at how do we deal with, first of all, the staff who are delivering the services, and also what is the reaction and the impact on the promise that we give in terms of healthcare. But as we progressed, there was increasingly interesting changes. First of all, the social fabric was broken. So even for people who are going to hospital, because Ben, remember that even with the pandemic, COVID pandemic, also other illnesses were still going on.
Sure.
So people were still going to hospital, having to go to hospital, though the numbers reduced. But at the same time, the social fabric of support also started crumbling because of the lack of gatherings, etc. Mm-hmm. So we actually noticed a very interesting trend. As businesses started closing down and support for Harambes and all that was dwindling,
yeah, we noticed that the voluntary membership actually, after the initial dip, started going up. In fact, in that year, we got a total of just over 540,000 new voluntary memberships that joined the fund. Yeah.
And we had predicted after the first and the second quarter that we're going to perform dismally. But what we have seen is that with the pandemic, there was also increased awareness of health and the need to have that protection. So a lot more people joined that previously were not there, which was a very interesting finding. Of course, because of the other protective measures, we also noticed a trend in drop of especially communicable diseases like diarrheal diseases, respiratory tract infections, apart from COVID, of course, reduced. And all this, in a nutshell, translated into us closing with a slight growth of revenue of slightly over 61.9 billion compared to the previous year of 60.8 billion.
All right.
But also on the claims, we had a slight increase of about half a billion from about 40.4 to about 51.2.3 there. Mm-hmm. So it was an interesting finding, and I would say that even up to now, we are still learning how to live in the new normal with COVID.
All right. Very interesting opening remarks there, Daktari. And for many Kenyans who perhaps are having different thoughts about the NHIF, of course, the image is very clear to majority of them that the NHIF has been embroiled in all manner of issues, from scandals, and the face and image of NHIF is actually tainted. Walk us through literally How do you reform such an organization? And of course, give us a sense of how significant is the NHIF in terms of feeding into our healthcare system?
Yeah. NHIF, to start with, is a 55-year-old institution. When NHIF was formed or established in 1966 as a department in the Ministry of Health, the primary role at that point was to provide medical cover for civil servants then. And you know, it was just shortly after independence. But very quickly realized that it would be a vehicle for providing a platform for cushioning Kenyans against medical expenses. So in 1972, voluntary membership was allowed. And from that time, voluntary members were allowed to join NHIF, contribute, and be able to get the benefits. The benefits from then were pretty simple. It was bed rebate, that you go to hospital, you're admitted, and it's reimbursed per day, a fixed amount. And way back then, that amount was sufficient to cater for the entire hospitalization. But however, as we advanced with time, the costs of care, as you are well aware, have been continuously increasing. The sophistication of treatments, which also increased the costs, and these costs continue to grow. So come 1998, NHIF was transformed to be a parastatal, so that now it has its mandate to be able to be more creative in terms of delivering solutions to meet the growing needs of the people of Kenya. And with time, as even the contributions increased and the rebates for the hospitals increased, a major turn in terms of providing comprehensive benefits happened in 2015. And in 2015, that's when we introduced outpatient covers, and also at the same time introduced packages to address the growing health needs of the people. And some of these packages include the dialysis package. And remember, His Excellency the President, during the last Madaraka Day celebration, actually gave that as an example. And things like the cancer package, things like the radiology package, where you have your MRIs, your CT scans done, things like road evacuation across the whole country, packages like for drug rehabilitation, surgical packages. So all these packages were introduced in around 2015, including outpatient services. So from that point, even our operation became more sophisticated, because now we are dealing with different packages and different models of reimbursement. Because for outpatient, to cater for all the 10.7 registered families, you need a model that you can be able to handle that paperwork. So as we progressed, and we've had our learnings, because that was the first time, we got challenges. And I think the biggest challenge we got, and was a great shock, was in the year 2018, 2019, where we made the first loss as a fund. And that loss, Ben, was spectacular. It was a 3.6 billion shilling loss. So you can imagine, from a point of surplus to a point of 3.6 billion shilling loss. And it is following that we realized that we must reform the institution to ensure that it remains sustainable because of the role that it plays. Because as we proceed with all those number of lives, we handle about close to 1 million patients per month. That is a great impact on the people of Kenya. So in 2019, there was a panel that was formed. It's called the Healthcare Financing Reforms Expert Panel, HEFREP, and came up with a raft of recommendations. And these recommendations were to ensure that those challenges that had arisen with a change of model, which is expected, that we are able to manage that, so that NHIF can continue to stay in its place in providing access to the quality, affordable care for all Kenyans. And at the same time, be a strategic purchaser of healthcare in this country, in our journey towards universal health coverage. So of these reforms, which were about 55, I'm happy to say that majority of them we've actually been able to address. Just broadly is like the digital transformation, for example, because if we're dealing with such high numbers, if we're getting to universal health coverage, we're talking about a huge volume of transactions, huge volume, which require real-time also intervention. Because if someone goes to hospital and it's an emergency, requires urgent surgery, you need the communication to be able to come to NHIF and the pre-authorization given in real time so that treatment is not delayed. We're also talking about the high volume of claims. You want to ensure that the claims are reimbursed in good time.
Yeah.
Because if we are talking about payment of claims, of benefits of in excess of 50 billion a year, we're talking huge amounts, and that cannot be done on paper. So our digital transformation to ensure that members have quick access through the biometric registration, through electronic claims, that is part of it. But also at the same time, you know, in a team, in an organization, it is the people who drive it.
Yeah.
So the organizational transformation was also one of the key reforms to ensure that we also align the skills of the staff with the tasks at hand, to ensure that we've aligned the organization with the emerging trends in healthcare financing to ensure that we're able to take the organization and position it as a strategic purchaser of health, not just at local standards, also at international standards. And then finally, to enable all that, we need progressive legislation, because moving from a point where we were just doing reimbursements to the sophistication that we have now, we need to have legislation that is supportive.